Good afternoon, guys. I hope we're all sparkly. If I'm looking a bit rough, it's because I'm feeling a bit rough. However, there's no rest for the wicked. What have you got to do? Crack on, because nobody cares. Work harder. Oh, we do care. I'm only joking. However, some of you need to rocket up your butts. Make decisions, move forwards. It doesn't matter if you fail, but move forwards. One of the cardinal presenting symptoms of low testosterone is paradoxically anxiety. And it can be really troublesome. Now, why do you have anxiety with low testosterone? Well, we're going to talk about the most important hormone in your body today. What's that? As a TRT doctor, is it testosterone? Is it DHT? Is it estrogen? No, it's none of them. It is cortisol. Cortisol is the most important hormone in your body, followed closely by adrenaline and noradrenaline. Why? These are your catabolic hormones and neurotransmitters. These are going to keep you alive. Now, you do need testosterone. It's an anabolic hormone, growth and repair, build those muscles. But without cortisol, you will die. What's it all about? Survival of the fittest. You have to survive. So what's keeping you alive? It's your senses. It's your sympathetic nervous system. So if you understand anything about the autonomic nervous system, you will understand you have sympathetic, fight or flight, parasympathetic, rest, relaxation. Now, it is way more complicated than that. So there are two parts of the vagal nerve. There's the dorsal vagal nerve, that is the reptilian part, that is this tonic immobility, this dissociative state that people get into. That is essentially activation of the dorsal vagal nerve. But most people know of the fight or flight, rest, relaxation parts of the autonomic nervous system. It's a little bit high level. Do you need to know about it? Well, kind of, yeah, because actually this is the reason why lots of people struggle. And it's not well understood. So, this anxiety, as I've said numerous times before, we are physical beings in a world of psychological stress. And your body releases the same hormones and neurotransmitters for psychological stress as it does with physical stress. And how do you manage that? Ashwagandha. No. Oh my word. Yes, just a little bit of KSF. Give me a break. So, we want to control cortisol and we want to control adrenaline and noradrenaline. How do you do that? Well, if you understand anything about the body, you will understand the need for what? Balance and stability. Now, we've already said you need cortisol to live. Catabolism. So what do you need? Anabolism. Testosterone, DHT, and estradiol. So people often present with an element of irritability with low testosterone. Because if you imagine like a seesaw, and you've got cortisol on one side and testosterone on the other side, that seesaw is unfortunately more cortisol dominant than it is testosterone dominant. Now, do you want it to be testosterone dominant? No, because what's it all about? It's about balance and stability. Our two favorite words at the Men's Health Clinic. When you have low testosterone, you want to correct that. You want to correct that by going superhuman, by going high. You do not want to do that. Homeostasis, this complex process that is trying to maintain a stable internal environment despite external changes and still battle with catabolism versus anabolism doesn't want you to be high. It wants you to be normal. What's normal? I don't know. But it really does. Do not underestimate the power of hormones. Every single endocrine system, there is an excess and a deficiency. Hyper, hypo. The HPG axis in a normal functioning male self-regulates. When you're on testosterone replacement therapy, there is no self-regulation. However, the consequences of high testosterone from a psychological perspective, so we know that obviously testosterone influences the amygdala. High testosterone makes you an arsehole. Plain and simple. And there are plenty of them around. What do you want to be? Cool, calm, and considered in every situation that you're presented with. Because we have to get on. Unless you're on the internet. Because that is a toxic minefield where I need to be right. You don't need to be right. You don't need to be arguing with people you have no respect for or know. Whew. I've removed myself from Reddit. As much as I want to help, can't do it. It's having a negative impact on me, and I have no interest in arguing with people who are right. You are right. So, with normal testosterone levels, you should have mental clarity. You should feel cool, calm, and considered. You should not be aggressive. Leave that to the bozos. Because what you need to do to resolve your symptoms is simply increase the dose until you do not have any symptoms. Now that assumes that there is only one cause for tiredness. Really? That assumes there's only one cause for low libido. Really? That assumes you're getting the picture, aren't you? These guys are absolute bozos. If you understand physiology and you understand the need for what? Balance and stability, you do not want to hike your testosterone levels up to where you have negative consequences. Now, from a physiological perspective, ignoring psychology, one of the major problems is a rise in hematocrit. Now, you can raise your hematocrit to a healthy level, but with an over-aggressive protocol or a protocol that is ineffective, aka not daily microdosing, you can see an artificially elevated hematocrit. And as I explain to my patients, red blood cells, they are physical things in a volume of liquid called the plasma within your cardiovascular system. That heart has to pump that blood around to the tissues to deliver the oxygen. The more physical things in this volume of liquid, what's going to happen to the viscosity? What's going to happen to that poor old heart? It's going to struggle, isn't it? What's going to happen to the integrity of those blood vessels with thick blood, which has to be pumped around? It's going to increase the chances of tears and subsequent clots and cardiovascular incidents. So, from a physiological perspective, we do not want to artificially elevate hematocrit. We want to be under close medical supervision to ensure your levels are optimal. What's optimal? Well, as we've said before, with every biological marker, you can have an excess or a deficiency. If you bring everything into balance, guess what? Everything is in balance. And that's what we're striving to achieve here at the Men's Health Clinic. So it isn't a matter of just whacking up your dose. It's a matter of normalizing physiology to allow psychology to work. Now, this anxiety from the mismatch of cortisol and testosterone, anxiety is obviously incredibly complex. However, consciousness is the subjective appreciation of subtle changes in your physiology. So, we want to be high. No, we don't. We want to be balanced, don't we? And then we want to look to other things that can negatively impact these symptoms that you presented with. It's a long list. But what do we talk about? Addressing lifestyle, reducing stress, improving sleep hygiene. We talk about nutrition. We talk about training. We talk about adopting a holistic approach to the human body, because not everything is testosterone. Not everything is cortisol. Not everything is nutrition. It is everything. We are designed to survive. We've made terrible choices. Our bodies don't care if it's Monday, the working week, or the weekend. Your male androgen levels follow a diurnal pattern because every day is a new opportunity to seize the day. What are you supposed to do? Wake up, high testosterone, high cortisol, go hunt, go gather. Get your food, which is your reward, and then have a bit of nookie and hopefully go to sleep. Cool, calm, and collected. Catabolic processes predominate in the daytime. Anabolic processes predominate at nighttime for a reason. How are you going to manipulate your cortisol? You are going to manipulate it by balancing your male androgen profile, looking to stimulate the parasympathetic nervous system. You can't do anything about the sympathetic. So you're going to look to breath work, and you're going to look to eating, hence comfort eating, but don't eat too much because obviously you'll become a chunky monkey, and there's way too many chunky monkeys out there already creating too much estrogen in this adipose tissue, which is negatively feeding back to the hypothalamus and pituitary, telling the brain that you have enough testosterone when you don't have enough testosterone. And then guess what? You have a lower testosterone. And what's going to happen to that cortisol testosterone balance? It's going to become further dysregulated. And you're going to have what? More anxiety. So what should you do? You should look to establish balance and harmony. You should look to address your lifestyle, your diet, and your training. You should look to support when necessary, and you should look to move forwards, because if you are unhappy in this current state, you are unhappy in this current state. You must do something. It doesn't have to be grand. It doesn't have to be grandiose. But if you're uncomfortable in a situation, what should you do? Move. Because life is all about movement.